Now we're going to touch base on some miscellaneous infectious disease, such as anthrax, not very common but worth noting, Lyme disease, which is becoming the big one, and vesicular stomatitis. Not very common around here, a problem in the western part of the United States, but worth knowing about depending on where you end up living, traveling, working. So anthrax, we discussed it a little bit in bovine medicine, but it's caused by Bacillus anthracus. Clinical signs essentially sudden death and cause septicemia. It is reportable, humans can contract it. It is also airborne, so if you for any reason have an anthrax suspicion, you don't want to, if you remember necropsy that animal, it needs to go to a special lab such as Cornell's lab because they have the level for ability. You have to do it with a respirator, things like that. There is a vaccine. It's not a vaccine I've ever seen or used. It's not something we really commonly deal with in animals, but it is worth knowing about, and it can affect all mammals. Lyme disease. So this is our big hot button one, caused by Borrelia burgdorferi, gram-negative spirochete. It's transmitted specifically by the Ixodes tick. The theory, as many of you know, that the tick needs to be attached for at least 24 hours because it has to start that whole drink the blood, swoosh it around its stomach, spit it back out. Clinical signs, these can be variable. The more we learn, the more the list gets longer, but again, incredibly variable. Fever, though often it's a pretty low-grade fever. They don't get quite, like 101, like 102, maybe 103. Depression, some stiffness, lameness. Loss of appetite. So sometimes the first presentation I see is some colic. The owner thinks the animal's colicking, and then I notice a mild fever. Swollen joints. Often the joints will swell, their limbs will swell. It can also change. Like one day it's this leg, one day it's that leg, kind of variable. Eye problems. They're also starting to see more mild neurologic issues, muscle atrophy issues, things like that. So all of these different clinical signs, sometimes combined, sometimes separate, give you an idea. So you combine that with if you're in a Lyme endemic area, such as the Northeast. Diagnosis, ELISA, also I have used the canine snap test and that's been pretty accurate. You can also send out, there's the multiplex test, which is a titer test, so that can help you differentiate between vaccination, chronic, acute exposure. But again, there's no clear perfect test that says yes or no. So you have to combine it with clinical signs. Also response to treatment. Treatment is a tetracycline of some kind, doxy, minocycline, oxytetracycline, etc. And it usually takes about 30 days. Usually you should see improvement within a week of treatment. If not, then you might want to start thinking about other options as well. Prevention, tick control and removal, so grooming your horses regularly. Also, field maintenance, making sure that your fields are not, that the grass doesn't get too tall so that you brush hog them, keeping the horses out of the woods or fencing in so that they can't go in and out of the woods from the field. That's where ticks like to go. It's definitely if you go on trail rides, things like that. There are like pro spot tick treatments for horses. I think they say once a month. Most people I know end up using them once a week. I've heard people putting Seresto collars around horses' ankles or fetlock areas to help keep the ticks off, at least their lower limbs. Most likely you'll find them along the lower limbs, belly, lower neck, and jaw from when the horses are grazing. Seldom are they much higher than that, though, they always like to break the rule. Vesicular stomatitis, this is a reportable disease. It's transmitted again by biting at insects. There are issues with this out west. Fever, salivation, vesicle formation on oral mucosa, then the coronary band, belly, muzzle, etc. So you do need to call the state vet if you suspect this. Can be something can require quarantine, etc. There is testing. Treatment is limited, spontaneous recovery. It can be very painful and irritating. Again, not something I've ever seen in this part of the country, but they did have outbreaks of it, I think, at some horse shows out in like the Colorado area. So more out west. Parasites. So one we want to talk about is habronemiasis. This is caused by either Dracaena megastoma or Habernema mucosae and microstoma. This causes an issue that we also call summer sores. So the larvae of these parasites get in the skin and can cause this eosinophilic infiltration and reaction. These really itchy, ugly lesions, they can be very small, they can be very big. Treatment is antiparasitic, anti-inflammatory, and antibiotic medications in case there's a secondary infection. I have had horses, they'll have these weird lumps on their body, and people bite bumps, and people think it's Habernemiasis, and it's actually usually inflammation to a tick bite. So that's also something under the Lyme disease. Sometimes you'll find this, maybe a nickel-sized elevated lump, maybe with a tiny hole in the middle, and that's why people think it's a parasite, but that's actually an inflamed tick bite, and they can last for a very long time. So sorry to go back on that, but something else to think of. These can be very hard, jumping back to the summer sores, they can be difficult to treat, but and I don't think they're very common anymore because most people keep pretty good deworming regimens, but easy to treat with antiparasitics and then topically the sores themselves. Okay, lameness. So this is a clinical sign. We talk about it more in lab, and hopefully I'll be able to get that to all of you. There can be all sorts of reasons horses have lameness issues. Shoeing, body condition, conformation, how they're built, immaturity, poor hoof care, systemic diseases, trauma, so osteoarthritis issues, the list goes on and on. So this is the AAP scale. 0 is not lame. 1 and 2 are the pretty inconsistent, difficult to observe. 2 you can see at the trot, but you need to usually do something like lunge them, certain circumstances. 3, consistently observed at the trot. If that horse is going in a straight line away from you, you will see the lameness. 4, you can see it at the walk. And 5 is non-weight bearing in the limb or a total inability to move. Diagnosis is a mixture of history, examination, nerve blocks, joint flexions, and then also things such as X-ray, MRI, ultrasound, bone scan, all sorts of things. So here you can see that head bob as the horse trots away, up, down, up, down, up, down, up, down, up, down, up, down, so right front. Up, down, up, down, up, down, up, down, up, down. And here is a pretty dramatic. This horse probably has a fracture. Most likely it looks like there's a fracture somewhere in the lower limb on that one. Also, just so you know, when horses develop hoof abscesses, they will usually be that dramatic with their lameness. And it will be overnight, so sometimes owners will call thinking their horse has broken their leg, and it's actually just a hoof abscess. So, FYI. So, diseases of the hoof, getting to hoof abscesses: canker, thrush, laminitis, white line disease, bruised soles, navicular, quitter, sand cracks, greasy heels, seedy toe, side bone, and ring bone are the ones we'll talk about. So canker, this is a bacteria, Fusobacterium necrophorum. It's similar to foot rot in cattle. It gets into their foot. Usually debridement and topical antimicrobials. Usually in this case, you actually have to put the horse under general anesthesia and clean it out, dig it out. I've also done some freezing of canker. Okay. These hoof surgeries, it's very simple, but they can be very bloody. So you need to be prepared, tourniquets, and a lot of bandaging because the hoof likes to bleed. Thrush, this is also Fusobacterium. It gets into the frog area especially. It'll make kind of this black foul-smelling crud around the frog itself. It happens when they're in unsanitary conditions or even just a lot of wetness and mud. You can clean it out. Use things like thrush buster or copper sulfate to try to dry the hoof out, picking the hoof on a daily basis and making sure they're trying to reduce them standing in that wet environment as much as possible. White line disease, so this is bacteria gets into the area right here where the white line is. It can cause separation of the sole. This can be mild to really severe. It can be very painful. They can lose chunks of hoof from this, and it can be a real nightmare to treat. Laminitis. So this is a disease that affects the lamina of the hoof wall. The lamina becomes inflamed. There are all sorts of reasons. We don't completely understand why. Usually there's some kind of metabolic issue, whether, like we said, anything from too much sugar to some kind of infection. The horse becomes toxic, endotoxic shock, etc. Causes an ischemic injury to the blood flow to the hoof, to those sensitive laminae, and this ends up destroying the support system of the hoof in the wall. The P3, the phalanx, will end up rotating, plus they can also have permanent damage to the blood flow to the hoof. And it will eventually break down. The hoof can separate from the coronary band, it can completely come off, and the P3 can rotate enough that it will go through the bottom of the hoof wall. Risks, some horses are set off by grazing on less pasture, that's too much sugar, grain overload, again sugar, some kind of inflammation, infection in body systems. Cushing's disease makes horses more susceptible to laminitis. Sometimes laminitis is the first sign of Cushing's, and excessive steroid administration. Here is an example. You can see this is where the coffin bone or P3 should be, and with this breakdown of the support mechanism, it will start to go down, and again, this can even go through the wall. This is not something you can usually cure. It is something that can be treated. There's different kinds. So there's subacute. They think this is when it's induced by riding on hard surfaces, trimming hooves too short, and can be resolved quickly without permanent damage. Acute laminitis, this is obviously more severe. Signs do not resolve rapidly, possible coffin bone rotation, and refractory, does not respond well to treatment. Chronic is continuation of the acute stage. There has been coffin bone rotation. It can be active, it can be stable, it will stop rotating, but you always have to be careful moving forward because you could cause another flare-up of it. Clinical signs, so increased digital pulses in one or both feet. Often if it's in the front feet and metabolically induced, it'll be in both. Weight shifting, they'll try to shift their weight back onto their heels or into their hind end. Lameness, pain, reluctance to move. Sometimes the horses will even be down and the only way you can get them to stand up is to do a nerve block and give them pain medication. Treatment, eliminate the cause, so if it's sugar, etc. Also, this can happen secondary to trauma, so if a horse fractures a leg on one side, the other leg taking all that extra weight can end up having a secondary weight-induced laminitis. NSAIDs to help with the pain, rest, endotoxin therapy, flunixin meglumine, or there's another drug called flunixin. Some people also will use DMSO. Reducing tension, so this is the biggest thing, supporting the foot. Frog support with bandages, shoes, there's special gel shoes, sole cast, sand stalls, lots of beddings. And also if you think a horse is having a laminitic flare or you're trying to prevent it, say they have some kind of infection, ice, cold water hosing, ice boots, things like that. Horses that have septic issues such as endotoxic issues from colic or placentitis, they'll just put them in ice boots as a preventative. Do not allow grazing on lush spring pastures, especially if this is the cause of their laminitis. Dry lots, muzzling during turnout to reduce their ability to eat. Avoid grazing in early morning and late evening. This is when grass is under the most stress and has the most sugar in it. Avoid high grain diets and be careful about changing their feed. Bruised sole, hoof abscesses, so moving on. Hard surface caused by stepping on small objects. Also, you can get a little bit of bacteria into there that causes an abscess that can be incredibly painful, that can travel throughout the hoof. Treatment, pare out the abscess if you can find it. NSAIDs, ideally, this says rest, but you do want the horse to move a little bit if it's a hoof abscess versus a bruised sole, and that can help to make the abscess move out. Soaking in Epsom salts, that helps to draw out the abscess. Also, ichthymol is an ointment you can put on that often you'll put a bandage and slather the hoof in ichthymol because it will help to draw out the abscess as well.